Today we'll be discussing RGP lens insertion and removal as well as lens care. You would wash your hands. That would be the first thing that you want to do so that you can remove dirt, oil, or bacteria. You would use an oil-free or a moisturized-free soap. After you've washed your hands, you would dry your hands with a lint-free towel. After you've dried your hands, now it's time to take your contact lens. You would place it right side up in the palm of your hands. You would use our Boston Simplest multi-purpose solution. You would take a couple of drops of the solution, you would place it in the center of the contact lens, and you would move from center to the outside of the lens. So you do center out, center out, center out, center out. You would flip it over and do the same thing, center out, center out, center out, center out. You'd never want to move in a circular pattern or circular rotation because this can damage the lens. After the lens has been cleaned, now it's time to rinse the lens. You would rinse the lens with a BioTrue rinsing solution. You would only use that to rinse the lens. So you would rinse, rinse, rinse on one side, flip it over, and rinse, rinse, rinse. After the lens has been rinsed, you would take it and you would place it on your index finger and you would put it up to the light so that you can check for any debris or cracks in the contact lens. After the lens has been inspected, now you are ready for insertion. To insert the contact lens, you would take your middle finger of your right hand and you would look down and place it at the lower lid margin. You would take the middle finger of your left hand and place it at your upper lid margin and look straight ahead. The contact lens would be placed on your index finger and you would place it in the center of your eye. After the contact lens has been inserted, to remove the contact lens, you would do or use the scissoring method. So you take your left hand and put it in a cupping position under your right eye, and you would use your middle finger and place it at your outer canthus, and you would move it temporally. After you've moved it temporally, you would just do a hard blink, and the contact lens would fall out of your eye, and it would fall in your hand. To store your contact lens, you would store it in your contact lens case. So you would put it in this designated area and you would store it with our Boston's multi-purpose solution, our Boston Simplest solution, and you would store it up for 6 hours or overnight. And it is best that you always clean your contact lens case so that it does not harvest any bacteria. You should replace your contact lens case between 1 to 3 months. If you are experiencing any discomfort, any irritation, or any redness to your eyes, it is best that you remove the contact lens and contact your doctor immediately. You should always have backup spectacles or glasses just in case you are told to not wear the contact lens for a period of time so that you are able to see. You should never shower or sleep in the contact lens. You should never use tap water. You should never use saliva to wet or store the contact lens because your saliva does carry bacteria. You should replace your contact lens annually, or if your contact lens is damaged, you can replace it at that time, but it should be replaced annually. Your wearing schedule would be a 2+2 wearing schedule, so you would wear it for the first 2 hours, and then the next day you would wear it for the next 2 hours, which would be 4 hours, and then the third day for an additional 2 hours. You would wear it for up to 12 hours, which is the maximum hour for your wearing schedule. Do you have any questions or concerns? Okay, you don't? All right, not a problem. Thank you for joining me for this session.